Hello, this is Dr. Wells from Wells Medicine. I'm starting to see a lot of patients around the holidays. So I wanted to discuss briefly some of the things that I talk about with patients around the winter holidays. So winter holidays can be a very difficult time for people, not only because there is sort of a cultural expectation of what people should look like and should have, and what family should look like and should do together, and how things should feel. And most of our lived experiences probably don't uh, equal or add up to the things that marketers are trying to sell us around what winter holidays season should look like. And so there's this great disconnect and comparison feeling that can be very difficult. There's also sort of a return to often either families of origin or a loneliness from not being with families of origin that can be very disconcerting as well. And then there's also the seasonal affective disorder that comes with this time of year. And the fourth thing that I see a lot of is a disruption in schedules, routines, patterns, habits. So this can be very difficult, even when you don't think you are a creature of habit. Disruptions in exercise and in eating right and in prioritizing sleep and in the alcohol that often comes around the winter holiday season can be very difficult, additions and subtractions for people. And then there is also the addition of things that are very socially challenging. So the buying of presents, the going to holiday parties, changes in sort of the workflow where big projects or finals or the end of the year things are coming up for people, and also the sort of social structure of another year ending and a new year beginning, and these sort of existential dread that comes with that. So there are some things that are just much more difficult around the holiday season, even if you love Christmas or Hanukkah's your favorite time of the year, or you love winter. There are some things that I think are kind of universally difficult out of those 4 or 5 things for most people. So I'll be doing some videos on each of those things and kind of how I cover them in clinic, and how ketamine infusions, but also therapy and journaling and sort of holistic life changes can help with making the best of each of those challenging situations around the winter holiday season.